Hey everybody, welcome to this Caregiver Coffee. My name is Matthew Estrad. I'm a gerontologist in St. Tammany Parish, and I've been connected with Coast for the past 10 years as the Caregiver Support Group Facilitator every week, and also as bringing you these Caregiver Coffee segments for about 5 years. So today is our fourth video in a series of fall prevention for older adults. And today specifically, we're going to be talking about footwear that is appropriate for older adults, footwear that is inappropriate for older adults, and the whys and all that kind of stuff. So I'll have some visuals as well, and I'll share a PDF that where I'm getting all this information from the Centers for Disease Control and Prevention. Before we get into this topic, just a little bit about the caregiver support group. In case you didn't see any of the previous videos, or this is your first video, that means you have not heard the spiel yet. So if you have heard it before, I apologize, but we're going to talk about it again, but you'll be an expert by the end of this one. So we have our caregiver support group every Tuesday evening of the year, except for Fat Tuesday. We moved that to Thursday of that week. And of course, if Tuesday is when Christmas or Christmas Eve occurs. So typically we don't cancel. We tend to move to later than a week if we have to do that. So, but basically, the first Tuesday of the month, we meet in person at the Slidell Activity Center on Cousin Street. On the second Tuesday of the month, we are on a virtual platform called Zoom, which many of y'all probably been on before. On the third Tuesday of the month, we're at the Senior Activity Center in Covington off of Highway 190. And then on the fourth Tuesday, and sometimes if approved on the fifth Tuesday of the month, we're back on the Zoom virtual platform again. Now with Zoom, you can join us on your computer. You can also download the Zoom app for free onto your smartphone or tablet and join us that way. And if you would rather just join us by phone, like a phone conference, you can certainly do that from a landline phone or even your smartphone. You can call just the numbers and the meeting code and password, and then you'll be connected. We'll hear you, you'll hear us, you just won't see us. So whatever method is most comfortable and convenient for you, we want you to try it out. There's absolutely no charge, and there's just a lot that comes from the fellowship of being with others who are on the same journey. And everybody's person that they're taking care of is different, right? So the journey is somewhat different, but we're still kind of walking alongside similar paths. And if you're a caregiver of any older adult, you are welcome to join us. Your loved one, if you are a caregiver, your loved one does not have to have dementia. But most of the caregivers that join us are taking care of someone who has some form of dementia. So there's a lot of experience in the room with the caregivers that you'll find yourself with. So we hope you'll try it out. Tuesdays, I didn't mention the time yet, but it's 6 p.m. to 7:30 p.m. Stay 30 minutes, stay an hour, stay the whole 90 minutes, whatever you can squeeze in. And we hope that having both the in-person option and the virtual option are helpful for you, because some people can't leave their loved ones at home safely unless they get someone to come watch them for that short amount of time. So we encourage you to do that, and we're always welcoming new members. So we hope that this piques your interest and that you are interested in joining us. One last thing about that, you can find out information about our support group, including downloading a 2-month calendar because we publish it every 2 months. And on that flyer, you'll also find out how to join the private email list to get reminders every Tuesday. Just go to coastseniors.org, go to caregiver resources, navigate your way to find my picture, and then there should be a PDF right there with all the information that you would need. So I hope that's helpful and you'll consider joining us. All right, now on to the topic at hand today. So it is feet and footwear for older adults, and I'm going to be using a fact sheet that was published in partnership with the CDC. I will, at some point in this video, I will show you some visuals of a shoe, but I'll give you just some highlights before we get to that point, and then we'll make sure this PDF, the link to the PDF is available to you. So falls are the leading cause of injury in older adults, meaning 65 and up. and they can have serious consequences like limited mobility, loss of independence, and even worse. Routine care for the feet and proper supportive footwear can reduce the risk of falls. And this is, if you've seen the other videos, this is just one of four ways to prevent falls. The others being talking with your healthcare provider, being really honest with that, checking your eyes, um, and gosh, I think I'm going to blank on other ones. Making sure that you exercise to keep your balance and your strength. And then the fourth one is having a safe home, and we offer home checklists for that. So okay, that's all the four of them. Um, and we lump in taking care of your feet along with taking care of the eyes. All right, so foot-related risk factors that might increase fall risk as we get older. Increased foot pain is one. Reduced flexibility in the ankle joint, reduced calf muscle strength, and that's the muscle that helps you rise on the balls of your feet, reduced sensation resulting from neuropathy, and the presence of a bunion or other toe deformities. And here's some health tips that we have here for footwear. Your healthcare provider or podiatrist can check your feet and determine if there are issues that increase your risk of falling. Podiatrists diagnose and treat these foot conditions all the time. Ask your healthcare provider to check your feet at least once a year and see a podiatrist if you have foot problems such as toe or foot deformities or foot pain. And I would say even say like ingrown toenails, thick toenails, things like that, that you feel when you or might feel when you are when you have footwear on. And we recommend working with a physical therapist to learn exercises to help you increase your strength and flexibility of your foot and ankle. And in a moment, as soon as I can zoom in, I'm going to show you a visual of proper footwear which makes it safe. Now, safety tips when thinking about shoes is always wear properly fitted shoes inside the home and outside the home. Wear sturdy shoes with low heels, traction, and strong arch and heel support. All right, now I'm going to share my screen. All right, so here we go. I'm going to zoom in a little more. Here we go. All right, so we'll kind of go around clockwise on the shoe. This is just an example. And after this, we'll look at unsafe shoes, and then I'll show you a variety of shoes that meet all the requirements of being a safe shoe, so you can kind of recognize them, and hopefully you have them on your feet right now. All right, the first thing um, is a firm collar heel for stability, so the back of the shoe right here. Then a beveled heel to prevent slipping right here. Broad and flared heel to maximize contact with the ground. A textured sole to prevent slipping. All right, so the texture can be many different things. A thin, firm midsole to feel the ground underneath. And laces or straps to ensure shoes hold on to the foot when walking and they're not going to slip out. So, and notice it says laces or straps. All right, so we have that. You can go ahead and pause if you want to, continue reading this and, just kind of looking at this visual. All right, we're going to move on to what makes a shoe unsafe. And these are two examples. All right, so on this loafer right here, we have soft or stretched uppers right here that allow the foot to slide around in the shoe, even out of the shoe. For these lack of laces for both this and the high heels, lack of laces means that the foot can slide out of the shoe. On the bottom of the loafer, slippery, and usually loafers are slippery, or worn shoes are a balance hazard, particularly in wet weather, or as I saw in a family member in January, or maybe it was February when we had ice and snow in Covington. And so slippery, this could be slippery underneath the high heel under the toes, and then high heels more than 1 inch, especially ones with the narrow heel. Of course, that's not very sturdy. That's not a great foundation. All right, let's take a look at some examples of appropriate shoes that can reduce the risk of fall. So we see a lot of boot-like options here. We even see some tennis shoes. So we see that this sandal right here, it's got a nice wide textured sole, and it's got straps that are going to keep it attached very well to the foot, just like this one as well. And here we see these do not have this is not laces, but another example of a strap. Now, this shoe right here, of course, it doesn't give me too much information or any detailed information about the shoes except what we can see, but this one kind of looks like a loafer to me. But maybe it's that particular brand that makes it safer. It does look safer than a loafer per se, the way that it is kind of covered right here. So maybe it's just that as long as it is fitting well, your foot is not going to slide out. So you can pause again. You can pause this and take a look. Hopefully, the shoes in your closet, they look similar to these, that they do not, or at least the ones that you're wearing on a normal basis are not, or these and not up here. Some additional safety tips. I'm looking on the right side of the page. Avoid walking in only socks inside and outside your home. That those can be slippery, of course. Avoid wearing shoes with heels over 1 inch, because we talked about that, or because they offer no ankle support, or with a smooth sole. Avoid wearing shoes with no back. Um, and they call it a slingback. Slingback. Even say uh, so like thong slippers or flip-flops. Those can be bad. Crocs, Crocs can be comfortable, but they can also be very, very dangerous because your foot can just come out of them very easily. So beware of Crocs. Um, shop for shoes later in the day to ensure proper fit in case your feet swell a little bit. Have your feet measured. So go to a store, get someone to help you. Accommodate foot deformities such as bunions and hammer toes by choosing shoes with a wide toe box. And actually, I've been watching some other videos for I've been watching um, I've been seeing some tips online about shoes, besides preparing for this, but they talk about having that wide toe box, even if you're not an older adult. Like our feet are meant to, I forget the term for like you're letting your toes spread. Um, but you want that to happen. You don't want them to be boxed in. Of course, some tennis shoes will do that. High heels, that will definitely do that. Sometimes loafers will kind of like pinch your toes, like kind of put them into a narrow box, and you don't want that, even if you're not an older adult. Consider a podiatrist or a specialist in footwear and devices, and their recommendations. You can go to this website right here, pedorthics.org, for a searchable directory of credentialed podiatrists. So with that, we will close up. I hope this was really helpful to you. I hope that you will like it so much that you'll donate some shoes, maybe discard, or maybe hopefully donate some shoes that are in your closet that you find are unsafe. It will keep you away from temptation of using shoes, and could possibly help you avoid falling. So you got Crocs, you got flip-flops and things like that. You got to be really careful. If not, throw them out. Uh, so anyway, so thank you for joining me for this. It's been a pleasure to bring this, and I hope that you use this not just as entertainment, but as some, actionable education that'll help you stay safe, stay as long as possible, as long as it makes sense to be in your home with yourself, with your loved ones. And until the next caregiver coffee, I wish you well. And let me know when you put these into action. Drop me a line, send me a comment somehow, and let me know if this was helpful for you. Thanks a lot, and I look forward to being on your screen in the future with more caregiver coffee tips. Bye for now.